Welcome to Heartbeat, the health guide for Marlette Regional Hospital, the summer 2014 publication. MRH's mission is to continuously improve the quality of health in the communities we serve, and that can be done in very many different ways. You come into the hospital or you come see one of our physicians when you're sick and we help make you better, but it also can be accomplished by helping you to not get sick in the first place, and so that's how we seek to achieve that mission. MRH helps people in the community in their wellness pursuit. We have some special programs and people in special positions who will actually reach out in the community, reach out to you, and let you know what kind of services are already covered in your insurance program. And they'll remind you to come in and get those preventative and wellness exams and procedures. And that helps you remember to get this annual screenings done to detect diseases. As we know, the earlier the detection, the better chance of recovery and prevention of disease. So we have an outreach specialist. Her name is Robin Pingle, and she can be reached at 989-635-1861. And you can call her, and she will help you know what's covered in your insurance programs and how you can get in to get those preventative services. I enjoy most about our community is that it's a country setting, and let me explain a little bit about that. I grew up in Fostoria, which is smaller than Marlette. And I went to high school in Mayville, which is smaller than Marlette. And I always had, as a part of my goal and dream as a profession, to never have to move to the city. I love the country, I love the rural areas. And so I've come to appreciate what is not easily available in the rural communities. And that one of those things is healthcare. So as a rural person, as somebody who wants to stay in the country, I want to make sure that it remains here and remains available to those people who live in rural community.
My name is Allison Nickel, and I specialize in family medicine and sports medicine. I am from Deckerville, Michigan originally, and I've been out of the area for a few years doing my schooling, and we recently returned back to this area and are ready to start working and being back in this area and enjoying all that it has to offer. I completed my education. My undergrad was at Eastern Michigan University in Ypsilanti, and then I went on to schooling in Kirksville, Missouri, which is A.T. Still University, or Kirksville College of Osteopathic Medicine. And then I went on to residency down at Botsford in Farmington Hills, and then from there I was down in Toledo finishing up my sports medicine fellowship. My office is located at the Marlette Hospital in the medical office building, and we are located in Suite 1. You can get a hold of me by either coming into the medical office building at Suite 1, or you can call our phone number, which is 989-635-4104. What made me choose to be a doctor was I did athletic training in undergrad at Eastern Michigan, and I also ran cross country and track. And while doing that, I got injured myself. I had a great staff that worked with me, but I realized that they couldn't diagnose, and I realized at that time that I wanted to be able to fully treat, diagnose, and treat all of my patients all the way from their injury to healing, to get back to enjoying what they love to do, and that's when I realized that I needed to go on for further schooling. I'll be providing care that develops with my background of sports medicine and family medicine that involves patients from pediatric to geriatrics, that is chronic conditions, well child checks, sports medicine injuries that can be knee pain, back pain, and then I also have an extra skill of having osteopathic manipulation that can help with some chronic pain issues that can help hopefully relieve them along with other treatment.
My name is Sherry Fricky. I'm a registered polysomnographic technologist and registered sleep technologist. I've worked at Marlette Regional Hospital for 15 years. A polysomnographer is a person who evaluates and scores sleep studies so that the physician can make his diagnosis. Home sleep testing is a process of evaluating a person's sleep in the comfort of their own home, which eliminates the need for missed work time, pet care, or child care. The unit is small and connected to a band that is worn around the chest. There is a wire that goes on the finger with a light in it. The white wire goes on top of the patient's hand, and there's a nasal cannula. This unit is placed before the patient goes to bed. A patient will turn it on and then go to bed for the night. They turn it off in the morning when they're done sleeping. To know if you qualify for home sleep testing, speak with your physician. Those who do not qualify would be those people that have severe COPD, congestive heart failure, or a known sleep disorder such as narcolepsy. Once your appointment time is set, you will come to Marlette Regional Hospital to pick up the home sleep equipment. You will be instructed and educated and all of your questions answered as to how to apply the sensors. Once you get home, you apply the sensors, turn on the machine, and go to bed. In the morning, you'll turn off the machine and return the unit to Marlette Regional Hospital. You may want to consider having a home sleep test if you snore loudly, if you're excessively sleepy during the day, if you wake up with morning headaches, or if you've been told that you gasp or choke during your sleep. Speak with your physician. They may order a home sleep test. A home sleep study can be scheduled at Marlette Regional Hospital at 989-635-4360 and also at McKenzie Health System by calling 810-648-6179.
My name is Dr. Akhtar, and I'm a board-certified family practitioner. I completed my medical school at Grace University School of Medicine, and I finished my residency in Akron, Ohio at Akron General Medical Center. DOT testing is mandated by federal government. DOT stands for Department of Transportation. To be qualified for the DOT testing, you have to take a federally mandated exam, and you have to pass the exam, and then you can perform the DOT physicals. We can perform the DOT test at Marlette Regional Hospital. DOT testing is necessary because we want to make sure our truck drivers are physically and mentally qualified and are safe to drive the truck. Basically, it's about a 45-minute to an hour-long exam. You can contact us at 989-635-4614 to schedule your DOT testing.
My name is Terry Haske, and I'm the chairman of the Marlette Regional Hospital Foundation Development Council. It's a group of volunteers that we've put together through community and business leaders to better serve our community and our relationship with the hospital and to share the hospital's needs with the community. The council actually was established in the spring of 2008, and in 2012 the administration of the hospital asked us if we would put together a project in which we pledged $100,000 to the renovation of the acute care facilities. Our pledge was actually over a 3-year period, and within 2 years, along with a generous contribution by an individual in our community, we reached our goal. We have now been approached by the hospital administration to establish another goal of $60,000 for the renovation and update of the long-term care facility. A way that you can get involved is contacting any of the foundation members or going to our website at marletteregionalhospital.org. Another area that you can contact is the foundation's number, which is 989-635-4011. An area that you can donate in, there's several committees that we have. One is called the Annual Support Committee, the other is called the Community Relations Committee, or the Business Development Committee. You can contact members there. They will get you to the proper area that you can make your contributions, or again, visit our website at marletteregionalhospital.org. Through the committees, we have several projects. One of those projects is our Driving for Health, which we hold every fall. The other is our Tree of Shining Love, which we held around the Christmas season. And the other is our Friends of Marlette Regional Hospital. Any of these any of these projects, the money goes to whatever project we have picked for the board. I'd like to thank the members of the community for their ongoing support of the foundation. Their support is what keeps us going. Their contributions, their time, their volunteer efforts, it's appreciated, and we hope it continues in the future. Thank you for watching this edition of The Heartbeat, brought to you by Marlette Regional Hospital.